All right, let's tackle one of the most intimidating parts of reading an ECG, the cardiac axis. I know, it sounds super complicated, but we're going to break it down into simple, practical steps. Stick with me, and by the end of this, you'll be calculating it in seconds. So what is the cardiac axis, really? Well, think of it as the main highway, the average direction that electricity flows when the heart's main pumping chambers, the ventricles, squeeze. Now, because the left ventricle has the massive job of pumping blood to the entire body, it's the biggest, most powerful muscle in the heart. It's the powerhouse, right? So it makes sense that the normal electrical flow, the axis, points right at it, down and to the left. So here's our game plan. First, we'll get the basics down. Then, I'm going to show you two powerful methods for finding the axis, a super fast one for emergencies and a more precise one for a detailed analysis. Finally, and this is the most important part, we'll dig into why any of this actually matters for taking care of patients.
Okay, let's jump right into section 1. Before we can find the axis, we've got to understand the map we're working with, the electrical map of the heart that the ECG gives us. Okay, picture this. The heart's right in the middle of a big circle, and the ECG's 6 frontal leads, they're like cameras placed all around it, each one giving us a different snapshot of the electrical action. For our purposes, we really only need to focus on 2 of those cameras. Lead I, which gives us a horizontal view at 0 degrees, and lead AVF, which looks straight down at positive 90 degrees. Those 2 create our main grid. And here it is, the magic range. A normal cardiac axis falls somewhere between negative 30 degrees and positive 90 degrees. If the axis is in that window, we're usually in good shape. But if it falls outside of that, well, that's a red flag, a clue that something else might be going on. And that's exactly what we're hunting for. So how do you use this map when you're in a high-pressure spot, like the ER? You don't have time for a protractor. You need speed. And that, my friends, is where the Quadrant Method comes in. It's an absolute lifesaver. The beauty of this method is its simplicity. We only need to look at lead 1 and lead AVF. Just think of lead 1 as your horizontal x-axis and AVF as your vertical y-axis. All you have to do is look at the main spike of the QRS complex and ask one simple question. Is it pointing up, which is positive, or is it pointing down, which is negative? That's it. This table lays out all the possibilities. If both lead I and AVF are positive, 2 thumbs up, the axis is normal. Done. If lead I is negative and AVF is positive, they're pointing away from each other, that's a right axis deviation. If they're both negative, pointing down, that's extreme axis deviation. And finally, if lead I is positive and AVF is negative, they're pointing towards each other. This suggests left axis deviation, but this is the tricky one that requires one extra step to be sure. So let's just visualize what I mean by positive. On this ECG strip here, you can see that the main spike of the QRS complex is clearly pointing upwards, away from the baseline. That's a positive deflection. It's really that simple of a visual check in lead I and AVF that makes this method so fast. Now for that critical tiebreaker. This is the one step people often forget, so listen up. When you suspect left axis deviation because lead I is positive and AVF is negative, you have to go check lead 2. If lead 2 is also negative, then you have confirmed a true left axis deviation. Do not skip this step. The Quadrant Method is fantastic for a quick assessment. But what if you need to be more exact? For that, we have another technique that can pinpoint the axis right down to the precise degree. Welcome to the Isoelectric Method. This technique feels a little bit like detective work, and it's remarkably accurate. It all boils down to a simple 3-step rule. First, we find the isoelectric lead. Second, we find the lead that's perpendicular to it. And third, we check the polarity, is it positive or negative, to get our final answer. So what in the world is an isoelectric lead? It's the one lead on the ECG where the upward and downward parts of the QRS complex are about the same size. It looks like the wave is kind of canceling itself out. This lead is our key, because the heart's true electrical axis is traveling at a perfect 90-degree angle to it. This visual shows you the core principle perfectly. The true axis is always perpendicular to the isoelectric lead. So for example, if you find that lead AVL, which is at negative 30 degrees, is the most isoelectric, you know the axis has to be perpendicular to it. And which lead is perpendicular to AVL? It's lead 2 at positive 60 degrees. And this is our final step. We just look at that perpendicular lead, lead 2 in our example. Is the QRS complex in lead 2 pointing up?
then your axis is exactly positive 60 degrees. If it were pointing down, the axis would be going in the opposite direction, to negative 120 degrees. And just like that, you found the exact degree. So, after all that, why does the axis actually matter? Well, this isn't just a mental exercise. Determining the axis gives us vital clinical clues about what's happening inside the heart. It's one of the first pieces of the puzzle we look for. An axis deviation is like a big, flashing signpost. A shift to the left can be a clue pointing towards left ventricular hypertrophy, where the left ventricle has gotten too thick, often from things like high blood pressure. A shift to the right might suggest the same thing is happening on the right side of the heart, or it could be a sign of a really serious condition like a pulmonary embolism. Ultimately, this is why we learn these skills. It's not just about reading squiggly lines. As our source material puts it, the correct diagnosis from an ECG can save patient lives. Mastering this is a powerful tool in your clinical arsenal. So, we've decoded the cardiac axis. It's a powerful first step in reading an ECG. It makes you wonder, now that you can find this one piece of the puzzle, what other secrets about the heart's electrical health are just waiting to be revealed on that grid paper?